are Group 16 and we will be presenting our group chosen IoT device, which is Smart Inhaler. My name is Roslinda and I will start with the introduction. IoT in asthma treatment. IoT can be characterized as a network and a set of devices used to collect, transmit and distribute data over the internet. The medical industry is also involved in this process, and smart medical devices are used by both doctors and patients. One type of such device which is gaining increased popularity is the smart inhaler. Asthma is a chronic disease that presents a very heavy burden to many people. One of many factors that contribute to poor asthma control is non-adherence. This brings the fundamental need for innovative solutions that could facilitate the monitoring and good asthma control. As a result, smart inhalers start to form the basis for the development of better treatment. What is smart inhaler? Smart inhaler are devices that connect to the mobile application on the phone. They allow following every important information such as the schedule of taking medication or circumstance of the use. The sensor is placed on the inhaler and communicate with the application via Bluetooth. This device enables patients to get help when they need it. Even in remote regions, reduce the time required to make a diagnosis and simplify research due to the significantly faster flow of all the most meaningful
Data collected by Smart Inhalers app. Medication usage. This can be used to set up an automatic reminder for the next dose. These inhalers help remind patients to use them at the right time and in contact with nearest doctor and pharmacists that prescribe their medicine and knowing the side effect of each dosage. Second, asthma attack occurrence. These records can provide data that predict asthma attack, thus allowing the patient to forestall them. This could help to reduce the clinical severity and length of each such episode, preventing worsening of lung damage. Third, weather condition. This feature can help changes whether it is drastic or slow changes of temperature. When it gets colder, the app will give warning as it is one of the factors of asthma attack to the patient, and the same goes to drastic changes in hot temperature. Fourth, medication adherence. Lowering the risk of severe asthma exacerbations, it will remind the patient to take their dosage wherever they are, tracking the extent to which a patient's actual dosing corresponded and when the next dosage should be taken. Fifth, exacerbation periods. Record the asthma attack and how many pumps that is used to calm down or shorten using the inhaler. The duration can vary, so it will detect what causing it and how long the airways have been inflamed. Lastly, long-term trend and statistic. Achieve and maintain control of symptoms. Maintain pulmonary function that is collected to normal level as soon as possible. Avoid adverse effect from
In a smart inhaler, the communication phase refers to the process through which the inhaler interacts with external systems, such as mobile apps, cloud services, or healthcare platforms like Smart Asthma. This phase involves several key components. First is the data collection, where the smart inhaler records time or date of dosing. Second is the data transmission, where the data collected is transmitted from the inhaler to a connected device via Bluetooth. Thirdly is the data synchronized with smartphone to record and track frequency and quality of inhalation. So based on the data, the system may provide feedback to the user via smartphone and notification will pop up regarding inhaler use or asthma management, and also updates on trigger or environmental conditions such as oxygen pressure, heartbeat, body temperature, and altitude. And lastly, reports can be generated from the data shared for review by health provider or patient.
Information generated from analysis. First, time use of inhaler. It records the exact time and date when inhaler used. Also analyze inhaler use over time to detect any increase or decrease in use. Second is dose compliance. Monitoring if the patient follow with the prescribed dose and identify if there are any missed dose. Third is geolocation analysis. It analyze use based on location data to identify a specific place and also track environmental factors such as air pollution. Fourth is health data. Inhaler use with reported system like shortness of breath or wheezing to identify periods of increased dialysis activity. Also, advanced smart inhaler can measure lung function and track change over time. Lastly is exacerbation rates. It's identified if that may indicate a higher risk of exacerbation or an asthma attack.
Medication delivery. For medication delivery, we will see how the smart inhaler tries to deliver a precise dose of the medication when the patients inhale through the devices. It is kindly similar with the traditional inhaler, but there will be a few features such as dose counters. There are some smart inhaler that have sensors to verify the medication will deliver it in a proper way during the inhalations, which consulting the patients to get a correct dose of every puff. The smart inhaler IoT system also can transfer the data to another application that related to asthma, but they still need to the doctor or to provide the permission first. For communication and data transmission, we have three parts, which is data synchronized, data processing, and alerts with notifications. For data synchronized, they have like the smart inhaler transmitted a data collected to a device like a connected smartphone app, cloud service, or it will go directly to a healthcare system or people. For example, we have Dr. Find AI or Smart Asthma app. Second, data processing. Data processing, it will processing the collected data to know more how closely the patient is following the prescribed by doctor. This will include it with how much does they miss their doses. Lastly, the alerts and notifications. The inhaler, which is usually the inhaler that we will get by our doctor, and they will have their own applications for the smart inhalers such as Find Air or Smart Asthma. It will send alert or notifications to make sure the patient take the medication on time and will want incorrect usage, or it will inform them about the battery levels.